CDC issues health alert warning new parents. What is Parechovirus? What are the signs, symptoms in babies? Coronavirus comes first. The monkeypox virus followed. Now the Parechovirus? The Centers for Disease Control and Prevention warned parents and pediatricians last week that a potentially hazardous pathogen is spreading across the nation in a health advisory. The agency reported receiving numerous reports of infections since May and urged medical professionals to check for them when patients exhibit specific symptoms. The PEVA3 strain, which is most frequently linked to severe sickness, is mentioned in the majority of reports, according to the CDC. The FDA declined to disclose which states reported cases or whether any fatalities were linked to the virus. Further information is provided as you move on in the video. What is Parechovirus? At Boston Children's Hospital, an infectious disease specialist Dr. Rick Malley said, Parechoviruses are typical childhood pathogens that are similar to enteroviruses, just like poliovirus. The virus comes in 4 different varieties, but only PEVA is known to harm people. There are various PEVA strains, but PEVA3 is most frequently linked to severe illness in newborns, the elderly, and those with compromised immune systems, according to experts. Parechoviruses are not new to the USA, according to Malley, but up until a few years ago, there was little surveillance. So it's unknown whether they're more common this year than in past ones. Parechovirus rash and other signs, symptoms. According to experts, parechoviruses can cause mild disease or serious illness. According to the CDC, respiratory tract infection, fever, and rash are the symptoms most frequently found in kids between the ages of 6 months and 5 years old. Fever, a syndrome resembling sepsis, or a neurologic condition, such as seizures or meningitis, may be symptoms in infants less than 3 months. According to the Mayo Clinic, meningitis is an inflammation of the fluid and membranes surrounding the brain and spinal cord. It can result in headaches, a fever, and a stiff neck. Malley advised parents to seek medical attention right away if they detect any indicators that their kid is not developing normally, such as fever, tiredness, irritability, lack of interest in food or drink, seizures, or uncontrollable movements. How are parechoviruses transmitted? According to the CDC, infected individuals can spread the virus through respiratory pathways and through contact with feces, whether or not they are exhibiting symptoms. According to the agency, a person can be infectious through the respiratory tract for 1 to 3 weeks and through the gastrointestinal tract for up to 6 months. Malley added that while a person may be contagious for a long time, the actual illness may only last a few days. As we discovered with COVID, it's a spectrum, he declared. Some kids seem to have a harder difficulty handling it and may be unwell for 3 to 5 days, while other kids seem to recover more quickly. Malley described it as a relatively short-lived, self-resolving infection in all other respects. Can babies die from it? Parechoviruses are extremely rare causes of serious illness and fatalities. According to Dr. Claire Bocchini, an infectious disease specialist at Texas Children's Hospital, the majority of kids have it at least once before turning 5 but may not know it since they had a mild or asymptomatic infection and weren't tested for it. We don't screen all of the youngsters who are otherwise okay with a little sickness. It is quite expensive and the management remains the same, explained Bocchini. Rarely, the virus may harm several body organs, including the liver, brain, and lungs, according to her. The patient can pass away and the brain could sustain irreparable damage. It's quite unusual, she remarked. Most kids don't have serious illnesses, but a small percentage of them, particularly very young newborns, can be extremely life-threatening. Because their immune systems are still maturing, Bocchini explained that newborns are more susceptible than other age groups to experience severe infections. What should parents do if they think their infant has parechovirus? Parechoviruses have no known cure. However, Malley advised parents to take their infant to the doctor if they see any symptoms. He emphasized that in order for specialists to better grasp the virus's presence in the USA, clinicians must assess the severity of the illness and notify the CDC when a patient tests positive. Malley advises using over-the-counter pain relievers like ibuprofen or acetaminophen, as well as drinking lots of fluids, to treat symptoms at home. How to prevent parechovirus? Good hand hygiene is one of the most crucial strategies to stop the spread of the parechovirus, according to specialists. Malley advises limiting the exposure of the infant to visitors from outside the home. He advises visitors to kiss the child's feet or toes rather than their cheeks and hands. Malley stated, "We don't want a great number of people coming in and picking up the child and kissing the child, even though it's a very wonderful event to have a child. If you happen to have a newborn in your home, it is appropriate to be alert and concerned. What do you think about our video? Please drop your views in the comments section. Thank you for watching.